All right, diving in, you guys wanted a deep dive on autism spectrum disorder and childhood-onset schizophrenia. And let me tell you, the stuff we're looking at today, super fascinating. We're going deep into this chapter from a child psychopathology textbook, a 2023 one. And what's really cool is that it doesn't just focus on the clinical stuff, the diagnoses and symptoms.
Right, it really brings in the human element.
Exactly. It weaves in the actual experiences of people living with these conditions.
Which is so important. I mean, you can read all the clinical descriptions in the world, but until you hear those voices, those lived experiences, it just doesn't hit the same way.
It's like, yeah, you get the facts, but not the feeling, not the real impact.
Right, and this chapter does a great job with that. It even includes perspectives from people like Dr. Temple Grandin.
Oh, yeah. And
Naoki Higashida, he's a young author, communicates using an alphabet grid. Super powerful stuff.
yeah. And, another thing I really appreciated, it kind of sets the tone for the whole chapter, is how he addresses the whole language thing. Like autistic person versus person with autism.
Oh, yeah, the whole identity first versus person first language debate. It's a big one.
It is. And the chapter doesn't shy away from it. It actually dives right in.
Which I think is great. It shows they're really trying to approach this topic with sensitivity and respect.
Totally. And it's more than just semantics. It really reflects how we see and value people.
Absolutely. For many autistic individuals and researchers, autism is a core part of who they are. It's not something separate. It's integral to their identity.
So using identity-first language is a way of acknowledging and respecting that. It's saying, this is part of me and I'm not ashamed of it.
Exactly. And it aligns with the whole neurodiversity movement, which emphasizes that neurological differences are natural variations, not deficits to be cured.
Right. It's about celebrating those differences, recognizing the unique strengths and perspectives they bring.
Exactly.
So, okay, let's get into the specifics here. First up, Autism Spectrum Disorder, or ASD. Now, the chapter does a good job breaking down the core criteria needed for a diagnosis, but it also goes beyond that. It really looks at how these criteria actually play out in someone's life, the impact they have.
Yeah, it's not just a list of symptoms. It's about understanding how those symptoms actually affect a person's day-to-day experiences.
Right, like what does it actually mean to live with those challenges?
So according to the DSM-5-TR, the manual mental health professionals use, there are two core symptom domains for ASD. First, you've got persistent deficits in social communication and interaction. And this is a big one. We're not just talking about being a little shy or awkward. We're talking about fundamental difficulties understanding and engaging in social interactions.
And the chapter emphasizes that these difficulties have to be present across multiple contexts. Right? It's not just about struggling in one specific situation. It's a pervasive pattern.
Exactly. Imagine trying to make friends, hold a conversation, understand a joke, or even just read someone's facial expressions when you're constantly struggling to decipher those social cues. It can be incredibly isolating and frustrating.
Oh, absolutely. And I think sometimes people misunderstand. They think, oh, this person just doesn't want to interact. They're choosing to be aloof. But it's not about that at all. It's that the social world can feel so overwhelming and confusing.
Right. It's like trying to navigate a foreign country where you don't speak the language. Everything feels unfamiliar and unpredictable.
And then you've got the second core symptom domain, which is restricted, repetitive patterns of behavior, interests, or activities.
Yeah, this can manifest in so many different ways. It could be a child who's very rigid in their routines, has to have things done in a very specific order, or maybe they have these intense, almost obsessive interests in certain topics or objects.
The chapter gave the example of an autistic child who found the sound of a vacuum cleaner totally distressing.
Oh yeah, and that brings up another important aspect of this domain, sensory sensitivities. Some autistic individuals are incredibly sensitive to certain sensory inputs. Sounds, lights, textures, smells, they can be really overwhelming.
It's like their sensory world is turned up way higher than ours.
Right, and for others, it might be the opposite. They might crave intense sensory input like pressure or movement. Remember Dr. Temple Grandin? She talked about how hugs felt like a short circuit to her nervous system.
Yeah, that image has always stuck with me. It's such a powerful way to describe sensory overload.
It really highlights the fact that the sensory experience of autism can be vastly different from what neurotypical people experience.
Absolutely. And it's so important to remember that ASD is a spectrum. The chapter really emphasizes that. It's not a one-size-fits-all diagnosis.
Right. The range of symptom severity is huge. You can have folks who are minimally affected, needing very little support, and then you have individuals who require much more intensive interventions.
No two autistic individuals are alike. I really liked how the chapter illustrated this with the case studies of Angelica and Denzel, both autistic, but with very different levels of intellectual ability and language development.
It shows how diverse the autism spectrum truly is. You can't make assumptions based on one person's experience.
Right, it challenges any preconceived notions we might have about what autism looks like.
Exactly. And thankfully, the chapter also takes the time to debunk that harmful refrigerator parent theory.
Oh, thank goodness for that. I mean, that idea that cold, distant parenting somehow caused autism, so outdated and damaging.
It's been thoroughly discredited. The chapter makes it clear that autistic children do form attachments, they just might express them differently.
So it's not about a lack of love or connection, it's about understanding their unique ways of relating to others.
Right, and speaking of unique ways of relating, the chapter delves into some really fascinating theories about how autistic individuals process information differently. One that stood out to me was theory of mind, or TOM.
Tom, yeah, that was a big one. So for our listeners who might not be familiar, theory of mind is basically the ability to understand that other people have their own thoughts, beliefs, and perspective.
Right, it's being able to step into someone else's shoes, so to speak, and see the world from their point of view.
And it allows us to anticipate how others might react in certain situations, to understand their motivations, to predict their behavior. It's crucial for navigating social interactions.
Exactly. It's kind of like having a mental model of other people's minds.
Right. And the chapter gives this great example, the Sally-Ann test. It's a classic test used to assess theory of mind in children. I have to admit, I found myself trying to solve it along with a description.
Haha, it's a good one. So imagine you have two dolls, Sally and Anne. Sally puts a marble in a basket and then leaves the room. While she's gone, Anne takes the marble out of the basket and puts it in a box. Then Sally comes back. The question is, where will Sally look for the marble?
And most people, even young children, understand that Sally will look in the basket because that's where she last saw it. That's theory of mind in action. They can understand that Sally's belief about the marble's location is different from their own.
Exactly. But autistic children often struggle with this. They might say Sally will look in the box because that's where they know the marble is now. They're having a hard time separating their own knowledge from Sally's belief.
And this isn't about intelligence. It's about a different way of processing social information.
Absolutely. It highlights that autistic individuals might approach social situations with a different set of assumptions and expectations.
And this ties into another concept the chapter explores: central coherence.
Central coherence refers to our natural tendency to see the big picture, to connect the dots, and form an overall understanding. It's what allows us to make sense of the world around us.
Right, like we're constantly piecing together information, looking for patterns and connections.
Exactly. But autistic individuals, they sometimes process information differently. They might focus more on details rather than the whole. They might get caught up in the specifics and miss the bigger picture.
And the chapter gave this interesting example, the embedded figures test, where you have to find a hidden shape within a larger, more complex design. Apparently, autistic individuals often excel at this.
Oh, yeah. Their attention to detail, their ability to focus on the individual components, it actually gives them an advantage in tasks like this. It's a great example of how differences in cognitive processing can lead to unique strengths.
And that's such an important point, right? It's not always about deficits. It's about recognizing that different ways of thinking can be incredibly valuable.
Absolutely. Think about fields like computer programming or data analysis or even art. Attention to detail is a highly sought-after skill in these areas. This difference in thinking isn't a limitation, it's a different way of perceiving the world that can lead to incredible insights and innovations.
And it really speaks to the diversity of the human brain. Okay, so we've talked about social communication, repetitive behaviors, theory of mind, central coherence. What about the relationship between ASD and intellectual disability?
Right. This is another area where it's important to avoid making generalizations. While intellectual disability is more common in autistic children, it's not a given. Intellectual ability in autistic individuals can range from profound disability to superior intellect. There's a huge spectrum.
And even within that range, you have the fascinating phenomenon of splinter skills.
Oh yeah, those islets of ability where an autistic child might have exceptional talent in one specific area, like math or music or art, even if they have general intellectual challenges.
It's like their brain has this incredible capacity for hyperfocus and mastery in certain domains. It really challenges us to rethink traditional notions of intelligence and recognize the diverse ways in which human potential can manifest.
Absolutely, and it underscores the importance of individualized assessments and support. We need to understand each person's unique strengths and challenges and tailor our interventions accordingly.
Okay, so shifting gears a bit now, let's talk about the pauses of ASD. The chapter's very clear there is no single cause. It's not that simple.
Right, it's a complex interplay of genetic predisposition and environmental influences.
So both nature and nurture are at play.
Exactly. Twin studies provide really compelling evidence for a genetic component, but no single gene has been found to be responsible for most cases. It's likely a combination of multiple genes interacting with each other.
And then you have those environmental factors that can also influence gene expression. The chapter mentions potential prenatal and neonatal complications like low birth weight or maternal infections during pregnancy, which have been linked to an increased risk of ASD.
Right, and this highlights the need for ongoing research to unravel all these intricate factors at play. We're moving away from those simplistic explanations and embracing a more nuanced understanding of the complexities of ASD.
So it's not about finding that one magic bullet. It's about appreciating the intricate tapestry of influences that contribute to the development of this condition.
Exactly, and that understanding can help inform our approaches to support and intervention.
Speaking of which, let's shift our focus now to the support and services available for ASD. And thankfully, we're moving away from that outdated idea of curing autism.
Right. The focus is shifting towards empowerment. It's about helping autistic individuals thrive in a world that's often not designed with their needs in mind.
So it's about adapting the environment, about providing the right support, and about celebrating their unique strengths and perspectives.
Exactly. The chapter talks about a wide range of interventions, from behavioral therapies like applied behavioral analysis, or ABA, to family interventions and medication for managing any co-occurring conditions.
It's important to note that ABA has been a bit controversial in recent years.
Yeah, there's been a lot of debate about it. While it has been shown to be effective, some of the techniques, especially in its earlier forms, were criticized for being too focused on modifying behavior to fit societal norms, like making autistic children appear less autistic.
Right. And there's a concern that some approaches might prioritize making autistic children appear less autistic rather than supporting them as they are.
Exactly. It's about finding that balance between teaching necessary skills and respecting neurodiversity.
Yeah, it's about helping them navigate the world effectively while still honoring their authentic selves.
Right. And the chapter even talks about the concept of masking, where autistic individuals try to hide their autistic traits to fit in, which can be incredibly exhausting and stressful.
Oh, absolutely. It's like they're constantly putting on a performance, trying to meet these expectations that don't feel natural to them.
It takes a huge toll.
So it sounds like the most effective interventions are individualized. You really have to take into account the child's unique needs and strengths.
Couldn't agree more. There's no one-size-fits-all approach. It's about collaborating with the child, their family, and a team of professionals to create a plan that promotes well-being and empowers the individual.
It's about creating an environment where they feel safe, accepted, and supported to be themselves.
Exactly. It's about moving away from a deficit-based model to a strengths-based one, recognizing the unique contributions and perspectives that autistic individuals bring to the world.
And speaking of unique perspectives, let's transition now to our discussion of childhood-onset schizophrenia. This is a separate condition from ASD, right?
Right. COS is not on the autism spectrum, but it's also a serious neurodevelopmental disorder with its own set of challenges.
And just as with ASD, understanding the lived experience of those with COS is so crucial.
Absolutely. The chapter includes an anecdote from a young person describing their experience of hallucinations. Very powerful stuff. Really gives you a glimpse into the reality of this condition.
It reminds us that while we can talk about symptoms and diagnoses, these are real people facing very real, often terrifying challenges.
Right, and it's our job to approach these conditions with empathy and understanding.
So, in terms of symptoms, how is COS characterized? What are we looking at here?
The chapter breaks it down into 3 categories. First, you have the positive symptoms. These are experiences that are added to typical functioning, like hallucinations, where someone might see or hear things that aren't there, and delusions, which are these fixed, false beliefs that are really hard to shake.
And those could be very frightening, right? Really disruptive to a person's sense of self and the world around them.
Absolutely. Then you have the negative symptoms, which are more about a decrease or absence of typical behaviors and emotions.
So we're talking about things like flat affect, where someone shows very little emotional expression, or alosia, which is a poverty of speech, or avolition, which is a lack of motivation and drive.
Exactly. And these negative symptoms can be really debilitating. They can make it incredibly difficult to engage in daily life, to experience pleasure, to connect with others.
It's like a part of them is missing, like their spark has gone out.
Right. It's like a part of them is missing, like their spark has gone out. And then finally, you have the cognitive symptoms, which affect things like memory, attention, executive function, social cognition.
And for our listeners who might not be familiar, executive function, Basically refers to those mental processes that help us plan, organize, focus our attention, regulate our emotions.
Right. So it's really about those higher level cognitive abilities that allow us to manage our thoughts and behaviors effectively. And these cognitive symptoms can make it really hard for individuals with COS to learn, to work, to make decisions, to function independently.
So it's a multifaceted condition, right? It impacts a person's thoughts, feelings, behaviors, their whole way of being in the world.
Absolutely. And it's crucial to remember that COS typically has a later age of onset than ASD.
Right, the chapter mentions it usually appears in late adolescence or early adulthood, although in rare cases it can emerge in childhood.
And when it does occur in childhood, it tends to have a more gradual onset and a more challenging prognosis.
That's really important to keep in mind. So while both ASD and COS are neurodevelopmental disorders, their typical trajectories can look very different.
Right, and that highlights the need for early intervention for both conditions, but for different reasons. With ASD, early support focuses on building skills and promoting development. With COS, it's more about managing symptoms, preventing further decline in functioning, and providing the right support to navigate this incredibly challenging condition.
We'll be right back to discuss more about the causes and treatment for COS in part 2 of our deep dive.
Okay, so we've established that childhood-onset schizophrenia, or COS, is a serious condition that can really impact a young person's life. What can you tell us about this causes? What are we looking at here?
Well, like with ASD, the causes of COS are complex. It's not a simple answer.
Not a single gene or anything.
Right, it's not that straightforward. The current understanding is that it's a combination of things. Genetic predisposition and environmental factors both play a role.
So nature and nurture working together, basically. Exactly. Family history is definitely a significant risk factor. If someone in your family has had schizophrenia, you're at a higher risk. But it's not a guarantee.
So genes are involved, but it's not just about inheriting one specific gene, right?
Right, it's more complicated than that. Multiple genes are likely involved, and how those genes are expressed can be influenced by the environment.
So it's not just about what you inherit, it's also about what happens to you, your experiences, that kind of thing.
Exactly, and the chapter mentions the neurodevelopmental model of schizophrenia. It's a way of understanding how these genetic and environmental factors might work together.
Okay, could you break that down for our listeners? What exactly is the neurodevelopmental model?
Sure, so this model suggests that you have this underlying genetic vulnerability. You might inherit certain genes that make you more susceptible to developing schizophrenia, but that doesn't mean you'll automatically develop the condition.
So the genes are like a predisposition, a possibility.
Right. It's like a blueprint that might or might not be fully expressed. And then you have environmental factors that can come into play. These are things that happen during brain development, especially in early childhood.
What kind of things are we talking about here?
It could be anything from prenatal complications like exposure to certain viruses in the womb, to difficult births, to severe stress or trauma in early childhood.
So these are events that could disrupt the normal development of the brain.
Exactly. And according to this model, when you combine that genetic vulnerability with these environmental insults, it can affect how the brain develops. Certain brain structures and functions might not develop the way they should.
And that sets the stage for schizophrenia to emerge later in life.
That's the idea. So it's not just about inheriting faulty genes. It's about how those genes interact with the environment during those critical periods of brain development.
It's a really intricate process. So turning to treatment, what are the most effective approaches for COS? What are we doing to help these kids?
Well, the treatment for COS is similar to the treatment for schizophrenia in adults. It typically involves a combination of antipsychotic medication and psychosocial therapies.
Okay, so two main approaches. Medication and therapy. What do the antipsychotics do?
They primarily target those positive symptoms we talked about, the hallucinations, the delusions. They can help reduce the severity and frequency of those experiences.
So they're helping the person regain a clearer sense of reality.
Exactly. But it's important to remember that medication is only one part of the puzzle. It's not a cure.
Because it doesn't address all those other challenges, right? The negative symptoms like social withdrawal and lack of motivation, and those cognitive difficulties with memory and attention.
Right, and that's where the psychosocial therapies come in. These are talk therapies and other interventions that aim to address those areas and help individuals develop coping skills and strategies.
So it's a two-pronged approach, medication to manage those more acute symptoms and therapy to address the underlying challenges and build long-term coping mechanisms.
Exactly. And there are different types of therapies that can be helpful. Family intervention is a big one.
What does family intervention involve?
Well, it's all about providing support and education to the family. It helps them understand the condition better, manage expectations, and learn effective communication strategies. Imagine you're a parent and your child is suddenly withdrawn. They're talking about things that don't make sense. They're hearing voices. It can be terrifying and confusing.
I can't even imagine.
Right. It can really turn a family's world upside down. And family intervention helps the family make sense of what's happening. It provides them with tools and strategies to support their loved one while also taking care of themselves.
So it's not just about supporting the individual with COS, it's about strengthening the whole family system.
Absolutely. A strong and supportive family network is so crucial for recovery. And then, in addition to family intervention, there's social skills training.
Okay, what does that involve?
Well, it's pretty much what it sounds like. It's about teaching those basic social skills that many of us take for granted. Things like making eye contact, starting and maintaining a conversation, understanding social cues, expressing emotions appropriately.
And these skills might be particularly challenging for someone with COS because of those social cognition difficulties we talked about.
Right. COS can really impact a person's ability to understand and respond to social situations effectively. So social skills training provides a safe space to practice and build those skills.
And it can help them feel more confident and competent in social interactions, which can have a ripple effect on their overall well-being.
Exactly. And then there's cognitive behavioral therapy, or CBT.
CBT, that's a popular therapy for a lot of different mental health conditions. How does it apply to COS?
Well, CBT focuses on the connection between thoughts, feelings, and behaviors. It helps individuals identify and challenge the unhelpful or distorted thoughts that can contribute to their distress. For example, if someone with COS has the delusion that they're being followed, CBT might help them examine the evidence for and against that belief.
So it's about helping them think more critically and realistically about their experiences.
Exactly. And it's also about developing coping skills for managing those distressing symptoms. Like if someone is hearing voices, CBT might help them develop strategies to distract themselves, to cope with the anxiety, to challenge the reality of those voices.
So it's about giving them tools to manage their symptoms and regain a sense of control.
Exactly. And it's empowering. It's not just about passively receiving treatment. It's about actively participating in your own recovery.
That's a really important message. And the chapter also mentions educational support for kids with COS.
Yes, that's crucial. COS can significantly impact a child's ability to learn and succeed in school. So it's important to provide the right supports. This could involve things like individualized learning plans, accommodations in the classroom, or even specialized tutoring to address their specific learning challenges.
It's about recognizing that they might need extra help to reach their full potential.
Exactly. It's about creating an educational environment that is sensitive to their needs and helps them thrive. And when you combine all these elements, the medication, the therapy, the family involvement, the educational support, you have a comprehensive approach to managing COS.
It sounds like a true team effort, everyone working together to support the individual on their journey toward recovery.
Absolutely. And early intervention is key. The sooner we can get these supports in place, the better the chances of preventing further decline and improving long-term outcomes.
And although the chapter acknowledges that COS is a chronic condition, it doesn't mean there's no hope, right?
Right, absolutely. Some individuals might experience periods of remission where their symptoms are minimal or even absent. Others might have more persistent symptoms that require ongoing management. But even with those challenges, recovery is possible.
So it's not a life sentence. There is light at the end of the tunnel.
Exactly. With the right support and treatment, individuals with COS can learn to manage their symptoms, develop coping skills, build resilience, and live meaningful, fulfilling lives. It's about focusing on their strengths, supporting their recovery, and creating a world where they can thrive.
That's such an important message of hope. And the chapter also delves into the neurobiological underpinnings of COS, what's actually happening in the brain.
Right, because as we learn more about the brain, we get a better understanding of these conditions. And research has shown some consistent findings. For example, individuals with COS tend to have a reduction in gray matter volume in certain areas of the brain.
Gray matter. Could you explain that a bit for our listeners?
Sure. So gray matter is basically the part of the brain that contains most of the neurons, the brain cells. It's where a lot of the processing happens.
So when they say there's a reduction in gray matter, it means there's a loss of brain cells.
Yes, and a loss of connections between brain cells. It suggests that certain brain areas might not be function as efficiently as they should.
And where is this reduction most prominent?
It tends to be most pronounced in areas like the prefrontal cortex, the hippocampus, and the temporal lobes. These are all areas involved in higher-level cognitive functions like Thinking, planning, memory, language, emotional regulation.
So it's not just random brain areas that are affected, it's these crucial areas that are involved in so many aspects of our functioning.
Exactly. And what's even more concerning is that this loss of gray matter seems to progress over time, especially during adolescence, which is a critical period for brain development.
So it's not a static thing, it's a dynamic process that can unfold over time.
Right. And this progressive brain deterioration is thought to be linked to the worsening of symptoms and the functional decline that we often see in COS.
Which again highlights the importance of early intervention, right? If we can intervene early, we might be able to slow down or even halt this process.
Exactly. Early intervention is crucial. And in addition to gray matter loss, researchers are also looking at other neurobiological factors that might contribute to COS, things like inflammation and immune system dysfunction.
Inflammation, like what we see in the body when there's an injury or infection.
Yes, but in this case, it's inflammation in the brain. There's growing evidence that abnormal immune activity in the brain might play a role in the development and progression of COS.
So it's like the brain is experiencing this chronic state of inflammation, which can damage brain cells and disrupt communication between different brain regions.
That's the idea. It's still an area of active research, but if we can pinpoint the specific immune mechanisms involved, it could lead to new treatment approaches that target the immune system.
That would be amazing. It really highlights the importance of continued research to deepen our understanding of these complex conditions.
Absolutely. The more we learn, the better equipped we'll be to develop more targeted and effective interventions.
This has been such an informative deep dive into COS so far. I think our listeners now have a much deeper understanding of this complex condition.
I hope so. It's a condition that often gets misunderstood, and it's so important to raise awareness, promote early detection, and provide compassionate support to individuals and families who are affected by it.
We'll be right back with more insights and final thoughts in part 3 of our deep dive. All right, so we've explored ASD, we've delved into COS, but before we wrap things up, there's one more thing I'm curious about.
True.
We've discussed them as separate conditions, but I'm wondering, are there any connections, any overlaps between ASD and COS?
Oh, yeah, definitely something researchers are really interested in.
So they're distinct, different diagnoses, but
But they might have some common ground. When you look at the symptoms, genetics, brain development, there are some intriguing overlaps.
okay, so let's break that down a bit. Where do we see those overlaps?
Well, for one, both conditions can involve challenges with social communication and interaction. We talked about how individuals with ASD often struggle with understanding social cues, navigating those unspoken rules of social interaction.
Right, like knowing when it's their turn to talk, interpreting facial expressions, that sort of thing.
Exactly. And while social withdrawal is more typical in COS, some individuals with COS also exhibit unusual or inappropriate social behaviors, maybe because they're misinterpreting social cues or having difficulty understanding the context.
So different reasons, but both can impact a person's ability to connect socially.
Right. And there's also some overlap in terms of repetitive behaviors.
Oh yeah, the restricted and repetitive patterns we talked about in ASD. The routines, the fixations.
Exactly. And while not as common, some individuals with COS might exhibit repetitive movements, speech patterns, or get really fixated on certain ideas or rituals.
Interesting. So maybe some shared pathways in the brain contributing to those behaviors, even though they manifest differently.
That's what researchers are trying to figure out. And the overlap extends to genetics, too. Studies have found that some of the same genes that increase risk for ASD also increase risk for schizophrenia.
So a family history of either condition might increase the likelihood of a child developing either ASD or COS.
Yeah, it's not a direct link, but there's definitely a shared genetic vulnerability, and that vulnerability might also be reflected in brain development.
Right, we talked about how both ASD and COS are associated with structural and functional differences in the brain.
Exactly, and some of the same brain areas are affected in both conditions, the prefrontal cortex, the limbic system. These regions play crucial roles in thinking, planning, emotional regulation, social processing.
So maybe some shared neurodevelopmental pathways at play, influenced by those common genetic vulnerabilities?
That's a strong possibility. But it's also important to remember both ASD and COS are highly heterogeneous.
Meaning,
There's a wide range of symptom severity, different ways these conditions can present. No two individuals experience them exactly the same way.
right, like we talked about with the autism spectrum, such a wide range of experiences.
Exactly. And that heterogeneity probably contributes to the overlap we see. It's a complex puzzle, but researchers are working on it.
It's fascinating stuff. So much we're still learning about the brain.
Absolutely. The more we understand, the better equipped we'll be to support individuals with these conditions.
Well, I think this deep dive has given us a lot to think about. We've really explored the unique challenges of both ASD and COS, but also those intriguing connections between them.
Yeah, and it's important to remember, while these conditions can have a big impact on people's lives, there's also hope.
Absolutely. With early intervention, the right support, effective treatments.
Individuals with ASD and COS can live fulfilling lives. It's about focusing on their strengths, helping them reach their full potential.
And as a society, we need to challenge our assumptions about what's normal, create a more inclusive world, accepting of neurodiversity.
I couldn't agree more. Embracing those differences, valuing each person's unique perspective, that's what it's all about.
Thank you so much for guiding us through this. It's been a really insightful deep dive.
My pleasure. Always enjoy these conversations.
And to our listeners, we encourage you to keep learning, keep exploring. Check out the sources we've provided for more information on these topics. And until next time, keep diving deep.